My name is Jessica Garner, and I'm a gastroenterologist at CHRISTUS Trinity Clinic. I was born and raised in Lake Charles, Louisiana, which has a population of about 80,000 people or so. So for me, I really loved growing up there because it was large enough where I still had a sense of independence and a lot of exposure to people of different cultures and backgrounds, but it was still small enough where it had that sense of community and small hometown feel. Hands down, it would be my parents. They were both very hardworking individuals who led by example. They always taught me to keep God first, as well as the importance of dedication and hard work and education. And so undoubtedly there's no question I would be here today without them and their guidance. Beyond love of science and mathematics, kind of both personally and as a family member, I really got a chance to see what it was like to have a physician who really took interest in not only my care but family members' care, and just what a instrumental role that they had in walking us through that journey. So it seemed like a perfect balance of being able to study something I love while having that ability to give back and be that support system in patients' lives. Gastroenterology has a variety of clinical problems and conditions which never really kind of, pins you into one particular thing. But what I love most about it is the procedural side of it, in that you have kind of this instant gratification when it comes to doing certain procedures, such as taking care of GI bleeds or food impactions. Patients immediately feel better. But you also have an ability to make an impact in the long run as far as colon cancer screening and prevention, finding polyps before they develop into cancers, as well as playing a role in terms of diagnosis and treatment of a variety of malignancies using things like endoscopic ultrasound. So you really kind of, not only can learn about patients, but also be able to intervene and do things right away that have a positive impact. My philosophy is very simple when it comes to patient care. I think that patient care has to be very patient-centered, and it has to be individually tailored to each patient. So as a clinician, I feel it's very important to meet patients where they are and kind of have like a team approach in terms of their treatment and coming up with a plan.